Hello everyone, welcome back to our channel. In today's video, we're going to talk about one of the scariest things that can happen in hair loss, and it's effluvium hair loss. This is sudden and dramatic hair loss. But before we get started, if you're new to this channel, welcome. Don't forget to subscribe and hit the notification bell. And if you're a returning viewer, welcome back. Thank you for your support. So effluvium hair loss is incredibly scary. It is a sudden, large amount of hair loss, and often kind of people feel like it's unexplained, it's come out of nowhere. Of course, we know that's never the case. So if you are suffering from something like this, don't panic, watch this video. So what is effluvium hair loss? It is a sudden shedding of an excessive amount of hair. It's very noticeable. You'll see hair everywhere, and it's quite rapid. And as scary as it is, the good news is it is a temporary condition. There are two types, and they're related to where the hair is in the hair cycle. So normally your hair is between three main phases. One of them is the growth phase. The other is kind of the interim phase where it stops growing and it prepares to fall. And then the final phase is the shedding phase. And then the follicles begin again with the new hair in its cycles. And this cycle is kind of ongoing. And obviously different hairs are at different stages. Otherwise your hair would drop all at once and grow at once. So that's kind of the normal hair cycle. But many things can disrupt this cycle, and that's when you get things like hair loss or excessive hair growth. Effluvium hair loss, there are two types. There is telogen effluvium, and this is named, this is when hair enters the resting stage, which is too quickly, and that causes sudden fallout of the hair. Then there is anagen effluvium, and anagen is normally the hair growth phase, and when sudden hair loss occurs during this phase, which is obviously when hair's supposed to grow, this is often more linked to underlying medical conditions. And so these are two useful distinctions to know because they dictate they hint at kind of treatment and prevention options. So what are the main causes? So the cause of effluvium hair loss, well, telogen effluvium, which is, like I said, when hair enters the shedding, the resting phase and sheds too quickly. The main cause of that is, to be honest, stress. And that can be emotional stress, or it can be stress brought on by an injury, surgery, something traumatic happening. So your hair just enters this kind of phase of non-growing, and then it sheds. Another cause of it is postpartum hair loss. So during pregnancy, hair grows abundantly, and then because of the excess estrogen, and then when pregnancy stops and the hormones balance out, the hair then falls out quickly. The hair that kind of grew, the new hair, will drop, and this period, this is normal, and you're shedding that hair, and normal hair returns, but it appears it can be quite dramatic as the hormones recalibrate and return to their normal levels. Then there are things like nutritional deficiencies, especially things like low iron, low zinc levels. If you're deficient in vitamin D or protein, these can also cause telogen effluvium. Certain medications can also cause it, and I'm talking specifically about things like antidepressants or beta blockers or some types of hormonal birth control. These can cause telogen effluvium. Also, another common cause is kind of sudden weight loss or crash diets, and again, these can cause stress, an increase in things like cortisol. They can cause hormonal imbalance, and they can, of course, cause nutritional deficiencies. And finally, things like chronic illness or infections, these can also cause it. With anagen effluvium, like I mentioned, usually there's a medical cause for it, and the main causes for anagen effluvium, which is a sudden hair loss that occurs but during what should be the growth phase, this is mainly due to things like chemotherapy, and radiotherapy. It could be due to toxic exposure to certain chemicals, or it could be incredibly severe infections or autoimmune diseases. And so these are the kind of the general causes for, most common causes for effluvium hair loss, whether it's telogen or anagen. The reason you should know about this is, one, if you do experience sudden hair loss, don't kind of ignore it. It means there's something generally wrong, underlying. There's a problem. It's your body, in a way, think of it as warning you. Other than when it occurs postpartum, it's usually there is something, an underlying cause. So go and seek medical help straight away. Go to your GP and get them to check you out. One, it'll be just to do a medical history, an exam, and take some basic blood tests to exclude an underlying condition. Also make note if there are other symptoms associated with it. Is there a change in your weight? Are there temperature or mood swings or fluctuations? Have you started any new medications, new diets, anything like that? Because these may hint at an underlying cause of this hair loss. So if the cause is obviously stress, then there are measures that you'll be encouraged to take. If the cause is a medication or an exposure to something or a medical problem, then it's important to treat that. Whatever it is, something needs to be done. The good news with effluvium hair loss is it is temporary, like I mentioned, and if you address the underlying cause, then you can get back to normal hair regrowth. Normally with effluvium hair loss, hair shedding lasts usually about 3 to 6 months, but it can take up to 6 to 12 months for the hair to fully recover and grow back to what it was. With anagen effluvium, the hair loss tends to be much quicker and more sudden, so it tends to fall out over a much shorter period, so within a few weeks possibly. And then but it does tend to take longer, because obviously it's dependent on finishing the course of treatment, and then you may not be physically well enough for your hair to kind of grow back at a normal state. So it will regrow, but it just takes longer. Apart from obviously managing the underlying cause of it, is just make sure that you support hair regrowth with a good balanced diet. Make sure you're eating a diet that has plenty of protein and iron and zinc and stuff like that. Make sure that you are looking after your hair well, massaging your scalp. Things like scalp oils can help just protect the scalp, make it healthier, to facilitate hair loss. Massaging can help increase the circulation, and that can boost blood supply to the hair follicles and increase the chances of hair and support hair growth. And whilst not necessary, of course, things like minoxidil can help. Things like microneedling or PRP, but to be honest, I think these are a bit of an overkill. If you are going to do something, I think use scalp oils and things like that, and really just focus on your overall health and well-being. If you really have to, minoxidil can help speed things up, but a lot of this is a waiting game, and nothing's going to happen without the underlying cause being addressed. So I hope that you found this useful. I'm going to leave an article I wrote about effluvium hair loss. If you have any questions or you want to share any experiences, please leave a comment below. If you like this video, please give it a thumbs up, and don't forget to subscribe to this channel and hit the notification bell if you haven't already done so. Until next time, stay beautiful.